The Lord be with you. A reading from the Holy Gospel according to Luke. Jesus was teaching in a synagogue on the Sabbath, and a woman was there who for 18 years had been crippled by a spirit. She was bent over, completely incapable of standing erect. When Jesus saw her, he called her and said, "Woman, you are set free of your infirmity." He then laid hands on her, and she at once stood up straight and glorified God. The Gospel of the Lord.
Praise to you, Jesus Christ.
We take a moment now, perhaps for the length of a Hail Mary or so, and we rest in God's saving word to us amidst our celebration of the life and memory of Luke, apostle, evangelist, physician, and patron saint of physicians. Striking, isn't it? The words from the book of Sirach are striking. They remind us, they highlight for us, they underscore for us that the physician's call is actually God's call to the physician. God's call to the physician to participate in the healing arts, to participate in God's healing spirit. And what does it look like for a physician to participate in God's healing spirit? We have that magnificent image from Luke's Gospel. Jesus encountering a woman bent over, burdened by physical illness and social isolation for 18 years. And he lays hands upon her and unbends. He unbends. He lifts her up. He restores her. He heals. That's what it looks like to participate in God's healing spirit, to participate in God's unbending. Those who put on a white coat say yes to this. They say, yes, I will participate in the unbending of others, God's unbending of others. My residency in internal medicine, as some of you know, was situated in the midst of the HIV/AIDS epidemic as it was emerging in the early and mid-'80s. Whole floors of the hospital where I served were given over to the care of patients with HIV/AIDS, most of whom were actively dying. We had no antiretroviral therapy. All we had were the use of antibiotics and antifungal agents in those days. We could slow down the infection, we couldn't stop it. This disease created fear in caregivers and patients alike. And then added to the patient's burden was the fact that many in society looked at them as lepers, looked at them as people on the margins, folks to stay away from. We had draconian infection control measures in place in those days. Just to see a patient, just to go into a patient's room, I had to put on a cap. I had to put on a surgical mask. I had to put on a full-length gown. I had to put on gloves, shoe covers. That was just to walk into the room. And I remember the day that I was rounding with my attending, and we were going bed to bed to bed, seeing each patient. And at one room, I stopped at the infection control station and began this ritual of gowning, gloving, masking. And I realized my attending physician had just brushed past all of those stations, and he walked right into the patient's room. And he sat on the edge of the patient's bed, and he placed his hand gently on the patient's arm. And he looked the patient right in the eye. at close range, and he said, "How are you doing today? What's happening today?" And the patient was shocked because this was the first person he had seen who wasn't covered from head to toe, who didn't seem to be treating him like a pariah. The patient was shocked, but then the shock drained from his face and he began to cry. And all he could manage to say was, "Thank you. Thank you." That's an unbending. He wasn't physically healed. The healing cut deeper. He was healed at a social, communal, emotional, spiritual level. That's the kind of unbending that those who wear white coats commit themselves to. Richard Weinberg, who's an academic gastroenterologist at Wake Forest University, wrote an eloquent essay a number of years ago in which he describes how a young woman with irritable bowel syndrome came to him for a second or third or fourth opinion. And she had seen numerous gastroenterologists, and the diagnostic opinion was always the same. This is irritable bowel syndrome. This is how you want to treat it. She never got well. So she went to see Dr. Weinberg in his office in North Carolina. And he thought, as he was examining her, it is irritable bowel syndrome. And what was prescribed is exactly what I would prescribe. But he went one step further. He actually gave her space to tell her story. And to his surprise, she showed up again the following week, and the week after that, and the week after that, until she revealed the secret that was at the heart of her symptoms. She'd been abused. He immediately wanted to send her to psychiatry and psychology, and she wouldn't go, because he was the one who was going to hold her story. And that's what he was doing, holding her story. That's an unbending. That's participating in God's healing. And it happens in medicine every day. The endocrinologist who spends a moment to speak to her young patient about what it's like to have type 1 diabetes. That's a moment of unbending. Or the chief resident who, on the 10th admission of a given patient over the last 24 months, stops to ask her what it's like to be admitted to the hospital so frequently. Or the intensivist who is the only one in the room with a patient dying of coronavirus disease. Those are moments of unbending. And that's what the white coat commits us to participate in that kind of unbending, that kind of healing, participate in God's healing. But we know, don't we, that that's not the whole story. We know that there are times when we ourselves need unbending. When we find ourselves bent by burnout, depression, anxiety. There will be moments when those who wear the white coat need to participate in God's unbending of themselves, God's healing. And so to wear the white coat is to make two commitments. To commit to participate in God's unbending of the other, yes. Also to participate in God's unbending of me. My own need for self-care. But all those who wear a white coat, keep those dual tasks in mind, those dual commitments, those dual convictions. Keep them ever before us. And may God bless all who practice medicine, especially those who train as members of class of 2024.